December this year marks 1 year since the launch of our COVID-19 vaccines, and as of now, over 40% of the global population is reportedly inoculated against the pandemic. But the emergence of a new variant is casting uncertainty over the course of our fight, and health authorities are urging for booster shots to ensure greater protection. For more, I have Dr. David Kwak from Sooncheng University here in the studio. Dr. Kwak, it's a pleasure to see you again.
Good afternoon, Sunny.
I also have Dr. Alice Hyungyang at Ms. Medi Women's Hospital. It's a pleasure, Dr. Dan, seeing you online now.
Thank you for having me.
I also have Dr. Aruna Subramania at the Stanford University, that is, live on the line as well. It's a pleasure to have you with us, Dr. Subramanian.
Thank you for having me as well.
We'll start here in the studio then. Dr. Kwak, from the start of the inoculation campaign, the world has been plagued by vaccine inequality, and it continues to remain a challenge. Why?
Well, so it's easy to make an assessment that unequal sharing by the developed countries resulted in the inequity that is lacking in the vaccinations in the underdeveloped countries. I agree with the idea that many of the developed countries was quite reluctant to share the overloads of the vaccinations that they had at hand, especially through the huge waves that hit both the continents while we were persevering through more globally. But I also want to point out to the factor that when we were first hit with the pandemic, everybody did not know what to expect to foresee in the near future. So I kind of understand the reluctance that the developed countries to really share the overloading stocks at hand, because if another huge wave were to hit those countries, they had to have something quite ready for themselves as well. So I do not want to sort of finger point and blame a country for not sharing their vaccinations, but looking into the future, I guess in the future we would have to come up with a better method and accessibility so that we can actually minimize this inequity, especially when we are expecting also to add, let's say, oral regimen to come into the picture in the near future. So for those, I think obviously with the oral pills, it will be much more accessible. So I think it'll be much easier to share with the rest of the world. But that being the case, I think also for the vaccinations, we would also need to create more chances for these underdeveloped countries to gain access to those vaccinations as well.
Right, because at the moment, a lot of priority has been placed on national interests, right?
That's correct.
Dr. Kwak, the world has, well, not the world, but vaccine inequality, that is, has been blamed for the emergence of Omicron by the World Health Organization. What are your thoughts on this, Dr. Dan?
Well, you know, anywhere there is a person with active COVID-19, we can have a variant emerge. Of course, if there is a community or region that has more unvaccinated or non-immune people with high rates of transmission, that will increase the chance of a variant. Also, infection of people who are immunocompromised is thought to increase the chance of having a new variant with higher numbers of mutation. And I think certainly having unequal vaccine distribution is playing an important factor, but I think it's much more complicated than simply having this as the one issue. I think vaccine uptake is also a very important issue. For example, in the United States, they have ample supply of vaccine. However, their full vaccination rate remains at 60%. According to the WHO, the United States reported the highest number of new COVID cases in the world. So certainly the next variant of concern could possibly emerge from the United States, despite having a large supply of vaccines. Also, in Africa, they are seeing more and more vaccine supply arrive on the shores of Africa. However, according to a WHO representative in Africa, having opaque vaccine delivery plans is actually the #1 reason that's holding Africa back in terms of a vaccination drive over there. So it's not necessarily just a supply issue. The other issue is overall COVID management. Here in South Korea, we have one of the highest full vaccination rates in the world. And yet we are seeing record-breaking numbers of new COVID cases. Our new daily COVID cases per million population is actually higher than India, Brazil, Colombia, and Mexico. And so certainly here in Korea, we have selection pressure, we have high transmission rates, and we could see the next variant of concern emerge in South Korea. The other issue is genetic surveillance ability. So I think the reason why South Africa was able to detect the beta variant of concern, the Omicron variant of concern, is because they have excellent genetic surveillance capabilities. I'm actually more concerned about countries that do not have genetic surveillance capabilities, low vaccination rates, and low rates of immunity. I mean, a variant could emerge in such an environment, multiply for weeks before being distributed around the world or distributed to another country where they do finally detect this new variant. So it's not just a matter of unequal vaccine distribution. There are many other, I think, factors that are at play that will determine where the next variant of concern emerges from.
Right, a very complex issue, of course. Meanwhile, Dr. Subramanian, according to White House Chief Medical Advisor Dr. Anthony Fauci, Omicron is, and I quote, almost certainly not more severe than Delta. Do you agree?
I do agree with what we know so far. You know, so far when we look at the countries where they have higher rates of Omicron, like South Africa itself, the physicians there are reporting patients with less severe disease, more milder symptoms, fewer people on oxygen, lower rates of hospitalization than they ever saw with previous waves. So this is all very, very reassuring. And so far in other countries as well, they're reporting milder cases from Omicron. So far, that's what it does look like. The reason we need to think a little bit and make sure of this and watch for a little while, of course, the first people to get infected in South Africa were younger, healthier people. Some of them had already been infected previously, so they had some pre-existing immunity. And so there were many reasons they could have had milder disease. You would expect them to have milder disease. And we really have yet to see how the disease is going to behave in older people, in unvaccinated, large numbers of unvaccinated, older, higher risk people. But hopefully we're getting enough vaccine rollout around the world that that shouldn't be as much of a problem. And the other reason to watch and wait is that, as you know, there's always a lag between cases and then developing severe cases, hospitalization, and then a lag for deaths. So right now we're seeing the spread of Omicron, and we know it's very contagious, but we don't have all the information yet.
Right. And against the concerns brought up by Dr. Subramanian, Dr. Kwak, there are concerns of Omicron's potential rapid transmission. And this has been raised because of early reports in Hong Kong about the variant spreading across the hallway of a hotel. Having said that, how do you respond to fears of Omicron's airborne risks?
Well, it's not just the report that came out of Hong Kong that shows us a brief picture of how much higher transmissibility that Omicron could cause. But also, we had our own case where a person who were wearing masks, who were acquainted just for about a minute or so, still got infected from another person who was carrying Omicron at the time. Throughout the different cases that are reporting worldwide, I think we're seeing clear, much higher transmissibility. I think it was WHO who made a statement just yesterday or at least a couple of days before that the R0 value of this Omicron variant could possibly exceed that of 2.0, which is far beyond anything that we've had in the past variants with 1.2, 1.3 that we had in Korea. So I think it is becoming rather more clear that it is definitely more transmissible. As Dr. Subramanian also mentioned, that we still have to see and observe what sort of severity and what kind of mortality Omicron still could cause when it spreads so much farther. We've had only a numerous cases so far in the country that we were able to trace back to. I personally believe that there would also be domestic cases that are already happening with Omicron, but we haven't really had much time to observe what exactly clinically these Omicron variants could cause. So we'd have to have at least a little more time to really assess how dangerous Omicron is in addition to the transmissibility it already has shown to have.
Right. Dr. Dan, how do you explain the relatively high rate of reinfection caused by Omicron as reported by experts in South Africa?
Well, I think it has first to do with the high rate of infection that was prevalent in South Africa. So seroprevalence studies, in other words, looking at how many people in the communities had antibodies to the SARS-CoV-2 virus. Seroprevalence rates were as high as 60 to 80% in some communities. So they have this background level of immunity or previous infections in that country. The second has to do with, I think, the immune escape properties of the Omicron variant. The Omicron variant has the highest number of new mutations of any variant of concern so far. And so it's just leading to a lot of immune escape. And then also, South Africa has a fairly low full vaccination rate, around 30% or so. And so I think it's the combination of those three factors that are leading to higher rates of reinfection with the Omicron variant compared to other variants of concern.
Right. Now, on a very slightly bright note, as my colleague Yeon mentioned earlier, Dr. Kwak, an early study by Pfizer that was shared Monday morning shows a third dose of its vaccine is effective against Omicron. How do you assess these findings?
Right. So from the two different reports regarding Pfizer's efficacy against the Omicron variant, a report said that only with the completion of 2-dose vaccinations with Pfizer, it created about a 40th of the neutralizing antibody that it used to make against any other variants. But with the third booster shot, they also said that it boosts about 25-folds of the antibodies it created before. So it's plus and minus combined. So it definitely, vaccinations, it still protects us against either from getting infected with any of the variants, and also it protects us from going into more severe progress of the disease. So vaccination is more of a necessity in any cases. So whether that be from booster shots or whether that be for the first shots they ever get, if they haven't been vaccinated yet, it'll still give us some sort of protection. Now, getting into more scientific details, so the Omicron variant is creating this evasion because it's formed slightly different, morphologically speaking, from the prior variants or the original variant of the SARS-CoV-2 virus. Now, it's the antibodies that are supposed to be formulated by injecting people with these vaccines still do formulate these antibodies that can somewhat attach to whatever the variants might be. So there's that overlapping of the morphological chain and key sorts of matching system. So even if it gets weaker, it does not mean it's obsolete. It does not mean it creates no protection. It'll still provide at least some level of protection. That's why vaccination still remains one most necessary method to really fight against the virus.
Right. Dr. Subramanian, vaccine makers are currently working around the clock to modify their vaccines to better target Omicron. What are your thoughts on these modification efforts?
Yeah, so all the companies, many companies have already said that Pfizer, Moderna, J&J, and Novavax, they're all trying to come up with Omicron-specific boosters, and they say they'll be ready in 100 days by March. And all of that is well and good. I think we should be prepared. We don't know enough about what the outcomes are going to be with Omicron as it spreads. But as Dr. Kwak said, you know, it's not that our current vaccines or the boosters aren't going to give us protection. So these still might be very protective in the real world. We can't always know how things are going to turn out in real life when you look at lab studies. So I think, we really need to wait and see, and people, as he said, do need to get vaccinated, need to get boosted. And yes, it's good that they're working on new formulations, but then as these new variants come up, they may come up quite frequently. They seem to be coming up quite rapidly. So how often are we going to need new boosters? And hopefully we can rely on some of the vaccines we already have to provide enough protection for us.
Right. And speaking about boosters, Dr. Dan, do tell us a bit more about the efficacy of booster shots as health authorities across the world seek to encourage members of their public to get it, a third dose, that is.
Right. So there was a the COMV boost trial was conducted looking at the reactogenicity and immunogenicity of 7 different vaccines used as a boost after a primary series of either AstraZeneca or Pfizer. So 2 doses of AstraZeneca or 2 doses of Pfizer, followed by a third dose or a boost of 7 different vaccines. And the only booster that did not achieve predefined criteria for minimum clinically important difference was Valneva, which is not used in Korea yet. But and when Valneva was used after a primary series of 2 doses of Pfizer, that was the only combination that did not show favorable results. Otherwise, the 6 other vaccines investigated, and they are AstraZeneca, CureVac, Janssen, Moderna, Novavax, and Pfizer, they all showed acceptable levels of reactogenicity. In other words, side effect profiles were acceptable, and favorable immunogenicity. In other words, antibody levels and T-cell responses favored the use of a third dose booster with any of these 6 other vaccines compared to placebo. And so what this gives is it gives governments, I think, flexibility and confidence in knowing that boosters will work in elevating immunogenicity, so immune levels in their population, and flexibility. Basically, we don't have to be assigned to one particular booster vaccine. Any of the 6 vaccines that were studied showed good results.
Right. Dr. Subramanian, keeping in mind what Dr. Dan has just said, where do you stand now on the debate over patent waivers for vaccines?
That's a great question. I mean, I do think worldwide vaccine equity is so important, as both of them said. There are many factors here, but, especially back in May, I really did think that we should be having, patent waivers, because we do need to allow for the production of generic versions and for the whole world to be vaccinated. It really feels bad when first responders, frontline workers in Africa and other places aren't getting protection, and we're getting boosters. So I know there are many factors at play here, but we really need to look at what's good for the international community and for health worldwide more than profits. So my personal feeling is in support of these patent waivers, and I think that we need to have more global cooperation to really to understand what's happening in one part of the world affects people all over the world, and we can't really just think about ourselves in our own country.
Right,
anymore.
We can't. That is true. And finally, one final question to you, Dr. Kwak. Let's go back to the topic of boosters. What has been disclosed thus far about the post-inoculation reactions to booster shots?
Well, I can give quite a simple answer to that. Nothing much. So it is not quite not anything different from what we had when we were completing our original schedules of vaccines. That is, we had some muscle pains. Some of them had a couple days of fever. Some of them had headaches. But nothing other than that, nothing happened. And really, booster shots just distinguished itself from the original schedules of vaccines. So if anyone is planning to receive the booster shots in the near future, they should not worry, because it's nothing new that they're going to get with the booster shot, only if it's milder. So I received mine a couple of weeks ago. I didn't feel anything.
I see. Well, that is good to know. All right, Dr. Kwok, as always, thank you very much for your thoughts.
Thank you.
Dr. Dan, thank you for your time and your words. And Dr. Subramanian over in the US, thank you very much for your insights.
My pleasure.